It's been a heavy year in the news, but at NPR, we always find time for a break.
Earlier this week, we reported on octopuses. Octopi?
A chance to dish with a friend.
Everything comes back to Love Island.
Love Island, everything. Or a quick nosh.
I mean, warm and potatoey on the inside and then the hint of onion. Oh.
Give back to the station that brings you joy and wonder, along with the news, by making your gift today.
Make your end-of-year gift at troypublicradio.org. And thank you.
I'm Kate Nesbitt, and this is The Rounds, a podcast where nursing professionals, community leaders, and nursing faculty share stories and practical advice for current and future nurses of all specialties. I'm joined by nursing student Brooke Mosley. And Brooke, today our guest is not just a nurse, she's also a business owner.
That's right. Tiffany Kimbro runs her own business giving at-home IV infusions. We'll talk about what all that involves and hear her advice for future nursing students.
So so I'm on the same track. Infusions, and I'm guessing from your business's name, it is IVs. What does that mean? I mean, I know what an IV is.
Yes. So just like, you would get an IV like in the hospital setting, we come to your home, start an IV on you. We have lots of different therapy or drips that we do. One of our really popular ones is called Recover Me. I kind of say it has like all the things in it. It's got amino acids in it. It's got magnesium. It's got vitamin C. It's got B complex, B12, glutathione, and Toradol, which Toradol is like a prescription drug. It's an NSAID. It helps with like inflammation and pain. It doesn't cause drowsiness where you wouldn't be able to drive afterwards. That particular drip is really good for like athletes or even like people that are trying to overcome like a GI bug, like, nausea, vomiting, diarrhea. It kind of replenishes all that's lost by throwing up and having diarrhea. And then the Toradol kind of like helps alleviate any pain and inflammation that they might have in their stomach. Another really popular one is called a Myers cocktail, and it's after a doctor that invented it, I think it was like the 1970s. And he was very much like a holistic approach of vitamins and minerals and nutrients to help your body get better. There's pretty popular amino acid called glutathione, which is actually already in our body. We're born with it. Our body helps make it, but it decreases as we age. And then certain things can help lower that. Foods and medicines kind of deplete that as well. So we give you glutathione to kind of help offset that and build that back up.
So you did the IV therapy for, 8 years before you kind of started your own business. When you went to begin making your own company, how did you use your past experience to kind of shape what you were building?
It made me really passionate about like home care and being able to infuse patients in their comfort setting. I don't know if you've ever laid on an ER stretcher before, but they're not the most comfortable. So it kind of like, that was our focus. Our chronic infusions that I worked with, that was more like chronic illnesses, autoimmune disorders, things that you kind of learn about in nursing school, but not really, because it's so like such a specialty. We did a lot of IVIG, which is replacing your IG therapy that you already have in your body, that is used for a vast number of things, from like neuropathy to multiple sclerosis to myasthenia gravis, all kinds of things. And then some that I had never like studied at nursing school, because you only do so much in nursing school. Even like Infusions, I don't know if have you heard of that one before? So it's for like Crohn's disease. It's like a 30-minute infusion. So like the chronic side, we did more of that stuff. Whereas what I'm doing now is more like holistic type approach of vitamins and minerals, to which we do have a lot of patients that have some autoimmune diseases that say like they swear by like, let me get the recovery infusion and I want to get it every 2 weeks because that keeps all of my symptoms from my lupus and arthritis at bay. So I think that's really cool.
Yeah.
So working in someone's home, there's obviously the difference between someone's home and a hospital. How do you kind of ensure that safety for those patients?
So patient aspect, I would say like you have, nursing standards, standard of care, hand hygiene, wearing gloves, cleaning your area, all those things remain the same. There's probably more of a safety concern for the nurse side of things when you go into somebody's home that you don't know, just of location. So you kind of just have to fill it out. You usually ask the patients, do you have any animals in the home? Can we put those away? Or, I love animals. I don't mind cats. I don't mind dogs. I know some people are like, but I'm just like, let them sniff me, let me pet them, and then I'll go wash my hands. And as long as they don't, maybe have somebody hold them or put them in a room while I actually stick you.
Yeah.
So that, some dogs might be like, what are you doing to my owner? Or cats are really nosy and jump on tables kind of thing. And I do have some patients that are like that, and they usually just kind of, go put them in a room, and we get everything situated, and then they can come out and they want to snuggle with you on the couch. I don't care. In this setting, I haven't had any patients that I would be weary of. On the chronic side, as a nurse manager, I had several nurses that would call me and say that they were uneasy, or they felt like the patient had some mental illness, that they didn't think that home infusion was the best way for them to infuse. And so on the chronic side, like we do have, they did have like some clinics where you could go in and infuse in a clinic setting. And Infuse does have a storefront in Luverne. Like if that was, what the patient wanted, they could go there. We just feel like, the mobile side of it is very appealing to a lot of people, especially when you feel bad. And when you feel bad, you don't want to go anywhere. You just want to stay at home.
Are there different like strategies that you have to take to like build trust? Like you were coming into somebody's home, like that is essentially their happy place versus them coming into a hospital.
Right.
Is there a difference in that kind of trust you have to build with them in different locations?
I say really not really. Yeah. I mean, even when you're a nurse in the hospital, like you're going into the patient's room, like you want to make them, feel warm and fuzzy inside. So like your communication is key, your mannerisms, in the hospital setting, you can kind of say like, I'm the boss. Mm-hmm. When you're in their home, you're not really the boss. Yeah. But kind of, a fine line, like being assertive, being kind, professional, compassionate, all the things that you learn, what makes you a good nurse in nursing school. We had a ER doctor once that he called it, I think it's like the four or five C's, and one wasn't even a C, it was a K. But he was like, what was it? Comfort, compassion, caring, and kindness. Think about all those things when you go in there. Think about like if that was your family member, like how would you treat them? Mm-hmm. I'm big on like doing to others as you would have them do unto you. So same concept, just being transparent, educate, being kind, being professional goes a long way. And I think that in itself builds trust.
Mm-hmm. So how do you determine, like if I were to come to you and just say, I'm not sure what I want, how do you kind of determine or tailor some of these infusions for your patients?
So we ask questions just like an assessment. Like if you went to a doctor's office, how are you feeling? What do you want? If they come to us and they say, I don't know what I want. I just feel like I'm tired all the time and I don't have any energy, and I'm, a busy mom or a busy construction worker or whatever, then we say, well, we have something that's called the Recharge Me. It's going to give you some B12, some vitamin C. Those things will help with your energy levels. We can start there. And if they say like, hey, I have like some muscle aches, magnesium is good as a muscle relaxant. Kind of, we ask questions to get them to tell us like what it is that they're wanting to either prevent or fix, and then kind of go from there. And then we also have our medical director and our nurse practitioner that has to have like a provider evaluation before we ever go see a patient. So like we as the nurse kind of ask some questions, give them some ideas of what they can do, and then we schedule an eval, which is a telephone call with our provider. They kind of talk to them, give them some more details, and then they say, okay, Tiffany needs to get the Recover Me, and she complained about like some GI upset, so let's add on some Pepcid for her too. And then we go and do it.
Do you have any advice for maybe nurses, healthcare professionals that are either looking into doing like IV therapy, or even like the entrepreneur side of like, that's a big difference going from nursing school to like owning your own business?
It really is. And if you'd asked me probably 3 years ago, I'd been like, oh no. Research. I know it's kind of silly sometimes, but TikTok really is like a good resource to just like get little snippets of people talking, because I feel like a lot of people are just honest on TikTok. Like they just rattle off whatever. And then podcast. I mean, There's a podcast that I listen to that is a nurse practitioner. And what me and Paige do is a little bit different because we aren't nurse practitioners, we're nurses. So we can't do like all the things, but we can like facilitate it to go that way. But the big thing would be to research, like learn about some business, stuff, learn about pricing, learn about products, learn about your area of like what is a need. Am I going to be able to make money doing that? Like, yes, nursing is like a warm and fuzzy, like, yes, I feel like it's a job that you're like led to and called to do, but also you got to make money because everybody has got bills to pay. So you got to think about both.
Yeah.
We've talked about earlier about how, research is a huge role in just continuously trying to, finding videos and podcasts and stuff. What does the education kind of play like for your business? Are y'all always looking for any research or anything to kind of give you more insight?
Oh, absolutely. Me and Paige both took like an actual course on IV nutrition. So, I mean, like anybody could do that. But that's kind of like where we got the bulk of our education from. And then just, educating on each ingredient, like we kind of tell our nurses, like we're going to give you, a printout of education of this does this does this going to help with this on like a cellular level. But we also expect our nurses to go on and be, take initiative and don't just take our word for it, like look it up. There's all types of resources out there at our fingertips now. So like really knowing what our ingredients do to your body and how that can help, alleviate symptoms, and then educating patients on like, hey, we're going to do this. But if this is going on, then you want to keep doing XYZ or try doing this so that you can kind of keep whatever ailment at bay, or, just, for instance, I'm sure you're aware of like the brat diet. That's like a big thing. That's, bananas, rice, apples, toast, to help with like bulk up your stool when you have diarrhea. So like, just the other day, I had a patient had like lots of diarrhea, nausea, vomiting, and so like I'm like, okay, I'm going to give you this infusion. It's going to replenish, what you got going on. It's not going to like stop your diarrhea per se, but it's going to make you feel better. Whereas if you're just at home trying to tough it out, that's what I would do. I'm not going to go to the ER because I'm having diarrhea. I want to poop in my own bathroom. Yeah. But then I say like, hey, try to take it easy, don't do anything too sweet because that sugar is going to make you have diarrhea. Try to eat some bland foods, follow the brat diet. Out of those 4 things, there's got to be something that you like. And if you don't like something, try something else, but like a baked potato, it's not part of the brat diet, but it's starchy and it's going to bulk up your stool. Kind of, that kind of education of how to help yourself.
Yeah. Were there any other, I know you talked about you and Paige took the IV nutrition course. Were there any other maybe certifications you had to have to be able to run this business or be an infusion nurse?
No. Nope, just get a business license and form an LLC and there you go.
And be a nurse.
Be a nurse, yeah. And have, have a medical director and a provider, as your team. Alabama did have a ruling about how there were some clinics that didn't have a nurse practitioner or a medical director on standby. They were going off like standing orders, and like the Alabama ruling was basically like, there was nurses were practicing out of their scope because nurses can't diagnose. Like we have nursing diagnoses, but it was kind of like a checkbox of you got this, get this. Whereas, we sort of do that, but we have a provider that does like a telehealth evaluation and puts in orders.
Yeah, they have the last say.
Right. Yeah. Like, I think in some of our recipes, like we have like Decadron and it's 10 milligrams of Decadron. And she'll say, hey, for them, I don't want them to have the full 10. I only want them to have 4 milligrams. Or there's certain, patients that can't have certain things, or if they have an allergy or something, like we screen, but then she still, takes that extra step of, I want them to have this. And remember, they have this allergy, so they can't have this kind of thing, of full circle, closed loop kind of thing.
I'm loving this podcast and finding out that I don't have to have extra certifications to do all these things. I love it.
Is there
a nursing degree?
Is there any like education that you would point maybe a student towards that isn't required, but you would probably recommend on this is some great information coming from this?
I would say really pay attention to like your nutrition class. Like I know that was probably like ages ago, but like really pay attention to nutrition, because nutrition really goes a long way. Like what we put in our mouths really affects our bodies. And if you like dial back down to like the root cause versus putting a Band-Aid on something, I mean, that's just better. Like, let's figure out like the reason and not just say like, why do you have a headache? Instead of just like popping some Tylenol or Advil, like why does your head hurt? Did you drink enough water? Is it a caffeine headache? Have you not had your coffee today? Have you eaten? You know, let's fix, you know, yeah, we can add in some prescription stuff, but if we find out like the cause, then we can better help, you know, prevent it in the future.
Are there any like skills that students can kind of build up, especially for not just like, you know, owning this type of business, but maybe just home infusions or dealing with maybe chronic cases that they can start practicing now?
I would say IV skills. I mean, really, you know, think about not just like your plump, juicy veins, but, you know, the ER really honed me to be a good stick. People in the ER are sick. They're dehydrated. They're whatever. They got crappy veins. So kind of figuring out like, you know, thinking outside the box. Like there's, you know, the famous saying, there's more than one way to skin a cat. There's more than one way to do all of the things. In the home setting, like you can't just holler out the room and say, hey, I can't get this line. Can somebody else take a look? No. You're it. One. Yeah. I mean, there's some things that you can do like, hey, I need you to drink some water. Let me make a warm compress. And, you know, you don't have to have a heating pad. You don't have to have a fancy, like, warm compress, the gel pack or whatever. You can take a glove and run some hot water in it and tie it a knot. And you got a water balloon. Or you can take a washcloth, wet it, throw it in a microwave for 10 seconds, and then you got a warm compress. Like, you're a little bit of a MacGyver when you work in the home setting.
So, do you stay at their house for the entire length of the fusion?
Yes.
So
you do not
are you
leave.
there for like 4 or 6 hours?
For like chronic stuff, yeah. But for like this stuff, it goes in like 30, 45 minutes to an hour. So like this stuff, you're in and out 2 hours tops. Unless you're Chatty Cathy, and then...
My thing would be if they had like pets or something. You wouldn't get me out of the house. I'm playing with the dog.
I am a Chatty Cathy.
I am too, but so it usually takes me a little bit longer. But I mean, I usually talk while you work.
Yeah. Well, in your building report, like it's
I mean,
job.
Yeah. You want them to feel like they're important to you.
Yeah.
And they are. I mean,
of course,
they really are.
When you were in school, were you expecting to be in the ER? Like, was that your goal when you were in there, or was it?
No, I was scared of the ER. I thought I was scared of the ER. What I really thought I wanted to be a hospice nurse. Like, I really wanted to circle back. Kind of like twofold of what drew me to nursing is that my husband, when we were dating, he walked in an armed robbery when we lived in Birmingham and was shot in the shoulder and spent 3 weeks at UAB. And I've always had a weak stomach. Like, I remember, like, I was probably 10 and my little cousin sneezed in the backseat of the car and, like, shoved his snotty, nasty boogers, and I threw up. And so I was like, I don't have the stomach for that. And then when my husband was shot, I had to wipe his butt. I had to change he had a gallbladder drain tube, so I had to change that tube. He ended up having a spot in his incision that wasn't healing, so I had to pack it. So then I was kind of like, well, Lord, I mean, I guess I do have a stomach for that. And the ICU nurses, they picked, they're like, we're going to make a nurse out of you yet. And I was like, I'm good. Thanks. Nope. I'm doing this because I love him. And then when my grandfather got sick and I became his primary caregiver, I was cooking breakfast. He had to poop. I had to wipe him. And then I was able to go back and eat my sandwich, obviously after washing my hands. But I was like, maybe I don't have a weak stomach. I mean, I kind of still do have a weak stomach on certain things. But I was like, okay. And then I had a friend that needed a babysitter. She worked in the ER. She's like, I think you should be a tech. Like, it's, be a tech. And so my last year of nursing school, I was a tech in the ER. And when I graduated, during my interview, the managers was like, well, we hope that you fall in love with it and want to stay. And I did. When you graduate, you kind of feel like, I felt like one of the biggest hurdles as a new grad was knowing where your supplies were and knowing who you could ask questions to. And even though like people might try to say like nurses don't eat their young, sometimes they still do. But I felt just comfortable like saying, okay, yeah, this is where I'm going to be. I know where my crap is. I know who I can ask questions to. I know who I shouldn't ask questions to. And I feel like that was a burden that just made learning easier.
Yeah. Made that new grad transition way easier, I bet.
Right.
Was there a certain person, whether it was a professor or someone during that transition that you really looked up to and really wanted to kind of, you leaned on a little bit more?
Oh, yeah. Crystalline and Miss Davis, like they both were like cheerleaders. Like Crystalline told me, she's like, you know, you have what it takes. Like, yes, I know that you say that you're struggling in classes, but your clinical skills, like your critical thinking skills, like in real life and how you treat patients and what you're doing with patients, this is what you're supposed to do. And so I was like, wow, you know, like,
Yeah.
okay, let me keep doing it then. Like that was, you know, my extra like positive encouragement of like, yes, I might have struggled on that test or whatever, but, you know, she gave me the confidence of, you know, in the real world, doesn't matter what you made on that test. In the real world, it matters like how you treated that patient. Did your mind think about, okay, I think this is going on with that patient and we should do X, Y, Z, and we should do this. And let's call the doctor and ask if we can do this. And she's like, that's what it's all about, you know, is being able to put all those books together and pull out like, okay, this is how it comes to this, and this was what it looks like in real life.
If you could like go back day one of nursing school and give yourself some advice or encouragement, like what would you say to day one?
Oh gosh. You got this. You got this.
I think that's what a lot of people say. They're like, just do it.
Just do it. Just do it. Don't give up. All the things that are hard, make it more rewarding.
Well, we've come full circle on this episode of The Rounds. We want to thank our guest, Tiffany Kimbro. But before we go, don't be afraid to hit that call button. Record a voice memo with your question for our guests and send it to kross120311@troy.edu. It can be anything from, how do I get started in nursing, to, why does my elbow hurt when I do this? Quick disclaimer, nothing you hear on The Round should be considered medical advice. If you have a serious medical question, please ask your doctor.
You can stay up to date on new episodes of The Rounds by subscribing on the podcast platform of your choice. And be sure to share with the nurse or nursing student in your life. The Rounds is recorded in the studios of Troy Public Radio and produced by Kate Nesbitt and the College of Health Sciences at Troy University.
So, until next time, I'm Kate.
And I'm Brooke.
We'll see you again next month when The Rounds returns.